Now, a total of 302 people so far have caught monkeypox in this country, and health officials today declared it, like COVID, a notifiable disease. In an exclusive interview tonight, we're going to talk to the first UK patient to go public with his diagnosis. 35-year-old HR manager James McFadzean contracted the virus on May the 25th after returning from Dubai. But James, who is gay, claims the UK Health Security Agency, which is in charge of tracing monkeypox patients, still hasn't been in touch with him. We can speak to James live now in a broadcast exclusive. James, good evening. Thank you for talking to us. Let me ask first how you're feeling.
I actually feel much, much better now. It was very rough for the first week, but now I feel fit and well, back to normal health.
So what was it like when you were first diagnosed? What were your symptoms? How did you know you had this?
So I really didn't think I had it. So everything you hear, everything you read talks about this telltale rash or lumps or pimples, which I never had at any point of the illness. I felt ill, much like a flu, fever, very exhausted, back pain. And on calling a local clinic, they advised that I should go for a monkeypox test, which I was surprised by, but I went along with. It was after that test that I got the positive diagnosis.
And you say you didn't suffer any pox at all, because that's obviously the thing that is really worrying. You see all these pictures of people with very nasty pustules, but that didn't happen to you in the slightest.
Not once, not at all. Not when I fell ill, not when I felt I was recovering. And of course, all of the news is saying once those pox have disappeared, you're fine to kind of carry on with normal life. Whereas where I never developed any, the doctors at first were a little bit confused about what advice to give me.
Now, James, we understand the Health Security Agency haven't been in touch with you at all since your diagnosis. That's true.
Funnily enough, not until 10 minutes ago, after my story broke, all of a sudden they found my right phone number. Which seems farcical, because every day I've been calling my clinic, the NHS Trust, trying to get someone to get people to call me so we can do contact tracing, so we can identify other people at risk, because I was before the number started getting big. So if they had trouble containing 50, 60, 70 cases, now we're getting into the hundreds, I can only imagine how long it's taking them to contact those people.
And how does that leave you feeling?
Annoyed. I mean, it's not like we haven't just gone through a pandemic, which is contagious, and we've needed to contact people. So you think, okay, the virus is different, but surely the infrastructure is there. As I said, 50, 60 people at the time I felt unwell. How many people does it take to call that many people? 2 people in a call center? It's frustrating. And the response they did to an article, we've been trying to contact him non-stop, turned out to be untrue. So just own the mistake, say we're getting on it, and do better.
OK, James McFadzean, very good to hear you're recovered anyway. You certainly look in good health. Thank you very much for your time this evening.
Appreciate it. Take care.